Hi, my name is Mark Daniels, and I'm a pediatric endocrinologist at Chalk Children's Hospital. I'm the division chief, and I'm overseeing a new program called Gender, Puberty, and Sex Development program at Chalk. Gender dysphoria is the sense that there is some distress or stress related to the fact that how you see yourself is not how the rest of the world sees you. And that can lead to anxiety and depression. So it's the dysphoria is when your understanding of who you are does not match with what the rest of the world sees. Sometimes people do not feel that they are the same gender as what their sex at birth was. So those people can generally be considered transgender if they are considering themselves the opposite gender of what they were born, or gender nonconforming, which just means they're not meeting society's understanding and norms of what gender is.
DSM stands for Diagnostic and Statistical Manual of Mental Disorders. Neither the DSM-1 1952 nor the DSM-2 1968 contained a diagnosis analogous to gender dysphoria. Gender identity disorder first appeared as a diagnosis in the DSM-3 1980, where it appeared under psychosexual disorders. It was used only for the childhood diagnosis. In the meanwhile, adolescents and adults received a diagnosis of transsexualism that includes homosexual, heterosexual, or asexual type. Finally, in DSM-3R 1987, it was then added gender identity disorder for adolescence and adulthood.
One impact of gender dysphoria is may having a higher risk of being the victims of violence and bullying. It means that they might try to show their own appearance in front of the netizen, which few of them are not willing to accept it. For instance, teenagers with gender dysphoria refuse go to school due to have pressure to dress up in a way that associated with their sex or afraid of being harassed, teased, or bullied. Indirectly, this will cause the teenager into school dropout and the other problems that might occur. Secondly, the impact of gender dysphoria is experiencing intense emotional distress. This is due to having feeling that they were born as the wrong gender. People with gender dysphoria are only diagnosed when a child is very disappointed about the difference between the gender assigned to them at birth and the gender which they feel themselves to be. As an example, a child who was born a penis may feel that they are actually a girl or vice versa. This can cause problems at home, workplace, and school which they might experience anxiety, depression, or thoughts of suicide. Lastly, people with gender dysphoria are also facing struggles in accessing health care for gender dysphoria, and some of medicine clinics seem not serving the transgender patients. In addition, gender dysphoria is not taught in medical training school and lack of doctors have the knowledge and comfort level.
First of all, gender dysphoria has nothing to do with a person's sexual orientation. It can affect people who are straight, homosexual, lesbian, or even bisexual. Not only that, gender dysphoria also can affect both gender non-conforming and transgender people. Feeling a strong sense of difficulty or discomfort with one assigned gender is one of the most common characteristics of gender dysphoria. So right now, I'm here to share some of the characteristics of gender dysphoria. Alright, so the first one is they will have a desire to not longer have the primary sex characteristic of their birth assigned gender. People who suffer from gender dysphoria may show a strong desire to be the other gender on a regular basis. They are frequently unhappy with their birth assigned sex gender expression. Secondly, They will have a desire to be treated like the opposite gender. Thirdly, a desire to have the primary and secondary sex characteristic of their preferred gender identity. Next, the insistence that they are a gender different from their birth assigned sex. They will feel like they are belongs to opposite gender, or like they think they are born in wrong gender. Next, cross-sex role also one of the characteristic of gender dysphoria. Other than that, they do have a strong rejection of toys, games, and other things that are typically associated with their birth assigned gender. Like, you know what? The society taught us to be what we have to be. We are not free to play what we want to play because we are shaped by them to be what they want us to be. Right? So last but not least, they prefer to wear clothing that are typically associated with the opposite gender.
Now, let's have a look on the statistic or data shows on the diagnosis for the gender dysphoria or gender identity disorder that report by Diagnostic and Statistical Manual of Mental Disorders. From the first diagram, we can see that it shows the range of an individual who's diagnosed the gender dysphoria. And we can see that both of the gender, either male or female, were diagnosed with gender dysphoria. But we can see that 80% of most of the female were diagnosed with the gender dysphoria. And both of the gender who suffer the gender dysphoria have encountered some type of psychiatric problems like anxiety, depression, low self-esteem. They have gone through the psychiatric treatment to overcome the symptoms that originating them from struggle with their gender identity. Next, we can see the diagram 2 shows the census has carried out to investigate the children in United States 2012 to find out the children who suffer from gender dysphoria. And we can see that there is 24% of the children were living in the single parents, which is just live with their mothers, will suffer from gender dysphoria. From what we know, that is father playing the significant roles to teach the children on the cognition on gender role playing. Without the role father playing, the children were easily to suffer the gender dysphoria. So in generally, in nowadays, we can see that there are near to 100% of the children will suffer from severe gender dysphoria, and most of them will live without father, which is single parents. Moreover, the next diagram shows how the incident happened to the people who suffer the gender dysphoria, which we call rates of co-occurring the disorder. So we can find out that there are 50% which charted the most of the gender dysphoria have facing the suicide, and the suicide was happened due to the social stigma, rejection, discrimination, bullying, and violence. Next, the second most was 26.3, which were the people with the gender dysphoria will resort to substance abuse. They are coping with the diagnosis related to the stress and oppression. That even though living with maltreatment increase the odds of substance abuse, particularly when dealing with a condition that is not as a social acceptable as it should be. Therefore, we can find out that it can define that incident or cases will happen due to some of the facts which are treat them unequally, include the negative reaction to the gender dysphoria person.